So most of the time when you're looking for a provider that does craniosacral therapy, my best advice is find someone that actually has a credential. Hi, Dr. Ludeman here from Bolingbrook Family Chiropractic. Today I am answering questions from our YouTube videos and our Instagram Reels. So someone asked, what is the difference between craniosacral therapy and chiropractic? This is a great question. I am so glad that you asked this question. So you will see the word bodywork online right now, whether that's in like your tongue tie group or your mom's group, or you'll see it's really truly never pediatricians, but we'll say pediatric dentist or your regular dentist that is like, oh, I heard that body work can help a child with latching issues, torticollis, those type of things. And so one of the main techniques that you hear about is craniosacral therapy. So craniosacral therapy is a specific technique that a chiropractor, osteopath, speech therapist, occupational therapist, massage therapist, or PT can take. So that is going to be a 75-minute or maybe 100-hour course, depending on what you're taking, and you're going to have some type of exam that you need to pass. There are also specific techniques like Upledger Institute where you can take 200 hours in a craniosacral technique and you become this certified practitioner of this Upledger technique. However, there's also craniosacral therapy courses that are for the layperson, aka parents, that mom can go on, take a 90-minute course, learn how to contact some points on the sacrum and the head and stretch the fascia, and now all of a sudden she's a craniosacral therapist. So most of the time when you're looking for a provider that does craniosacral therapy, my best advice is find someone that actually has a credential. So if someone's like, oh, I see so-and-so for craniosacral therapy, cool. What degree do they have? Are they a chiropractor? Are they an osteopath? Are they a licensed massage therapist? Are they an SLP or an OT or a PT? If I was taking my kid to any practitioner, I would want to make sure that they're licensed and they have malpractice and they're in network with our insurance. So if you're seeing somebody that just took a weekend course online and then took a little quiz and now they have a little like certificate, cool, great, that's awesome. But you're probably not someone that you should be 100% trusting what they say, because they technically cannot diagnose. They can't give you a diagnosis. They can't bill your insurance. They don't have malpractice to protect you and your child in case they do some type of irreparable damage, because they're not a licensed professional with malpractice. So I have heard this often and actually have a massage therapist friend that is taking a course, and I went to go look at it. And as a chiropractor, I can go take a course for $197. If I want the workbook shipped to me, I can pay roughly $210, and I can take a class that is 77 minutes long and go take a quiz, and all of a sudden I am now certified in craniosacral therapy, which is fine. Like, that's great. Like, it's probably information that I already know from all of my other technique stuff, but just so people are aware, like, you can go online and spend around $200 and watch one video and take one quiz that you can take as many times as you need until you pass, and now you can say that you are a craniosacral therapist. So the difference between chiropractic cranial work and craniosacral therapy is that we spend 100 hours, 200 hours learning specifically about the development of the cranium and like the embryology behind that. We learn at what ages these different bones are forming and what tissues they are coming from. And then from the technique portion, we're learning the ways that those bones articulate and what they do on inhalation and exhalation, if they go internal or external. That is more involved technique than a $197 course that you are taking on a weekend. So as a chiropractor, I have a license, I have a national license, I have a state license. I pay malpractice every year. My malpractice is $1 million and $3 million. I have higher training to diagnose and assess a cranial issue and still adjust a baby sacrum and still work the fascia of the sacrum and still adjust the thoracics and work the fascia of the thoracics and work the fascia around the head and actually adjust the head and the cranium and get palatal and cranial movement. So the long story is basically chiropractors, osteopaths, physical therapists, SLPs, or OTs, if they are trained in craniosacral therapy, hopefully have done 100 to 200 hours in additional training, and they have a license and they have malpractice to warrant what they're doing, and they're able to make a diagnosis, versus someone that's taken a CST course for $197 online and took a quiz, and now all of a sudden they are supposedly certified to see your kids. So really long answer, but there is a significant difference.